afternoon, ma'am. I am Retdem Catubig from AMDNA, Second Year College, Section B. So today's video presentation, I'll be performing nasogastric tube feeding. So nasogastric tube feeding is a special tube that carries food and medication to the stomach through the nose. So let's start. But first things first, we really need to check the doctor's order. Then after that, it is the time to wash our hands or do the hand hygiene with alcohol. And after that, it is the time to gather all our needed equipments and bring it into the bedside. Then after that, we really need to identify the patient and explain the procedure. But before we identify our patient, we really need to greet our patient. So, good afternoon, ma'am. I am your CNA today. I am Retdem Catubig. Kung sa ngalan, ma'am? So, after that, explain the procedure. So, atong buhaton nun, ma'am, is nasogastric tube feeding. Tagaan kag food, panagis imong ilong. Okay, ma'am? And after that, it is the time to position your patient in a semi-setting or Fowler's position. Then after that, we really need to check the tube displacement. And we really need to ask the patient to open his mouth to check the back of the throat to make sure that the tube is not coiled. Ma'am. Then after that, we really need to ensure the recommended external length of the feeding tube is measured and consistent for each feeding. Then after that, we really need to make sure that the feeding tube is secured firmly to the nose and the cheek of the patient with a tape. Then, it is the time to give feeding. But, first things first, we really need to give instruction to the patient as well as the watcher. So, ma'am, oras na para taganti kag tube feeding. And sir, ikaw ang watcher, sir?
Yes, ma'am.
So, sa karon tagaan siya na feed tubing, then pwede kang makakuha technique kung unsaon. Okay. After that, it is the time to follow feeding with at least 60 cc of water. But I have here 25 ml. We just put a water until it is 60. Then to prevent air entry to the stomach, we really need to kink this feeding tubing before putting this syringe. Then, pour 60, 25 first. Another 25. And then 10. Then, it is the time to give feeding according to the schedule. Just pretend that we need 60 cc also. Then, position your syringe slightly over your head. Make sure not to empty syringe while feeding. Another 25. Then 10. Then to complete the feeding, flush the 60 cc of water. Another 25. And then 10. Then, it is the time to close the feeding port. Then after that, position your patient in a comfortable position. Then do aftercare of our equipment. Wash hands or do hand hygiene. Then do charting. That would be all. Thank you for watching.